Hello, Dr. Lowry here again. Welcome back, and this is our final chapter on urinary tract infections and how to diagnose those at home. These happen, of course, more commonly in women with burning urination, frequency, going to the bathroom every hour, an odor to the urine that would suggest a urinary tract infection. Other mimickers include yeast infection of the vagina, with burning and itching, also frequent urination that's not painful from elevated blood sugars, where you're peeing every hour due to the effects of the blood sugar. So it helps to have some way to diagnose this at home, and I picked up these strips. They're called URS-9. URS-10 includes glucose, but there's dozens of these online. And as you see on the back, they have a little graph that you compare them to. Now, this is very easy to do at home, and then upload to your doctor, show them a picture or describe what you find. And you'll see the panel here that includes leukocytes, nitrite, urobilinogen, protein, pH, blood, ketone, bilirubin, and glucose is usually at the bottom. Now, you basically pee in a cup, and then you dip this in, get all these little squares soaked, and then you wait for leukocyte 2 minutes, for nitrite 60 seconds, on down the line, and it tells you when to read those. And then the scale goes from negative, you see that, to positive. And I'm going to include that in a graph, but you can look at this online, and there are videos online as well. Now, there are various kits. This was 9, there's 8. I would go with 9 or 10, but I would look to make sure glucose is involved as well. Now, again, this is easy to do, and then afterwards, if you're very positive, the leukocytes or nitrites are produced by bacteria in the urine, and then if there's blood in the urine from a urinary tract infection. So those three things would cinch a diagnosis of urinary tract infection, and then you can phone that into your doctor. Again, there are 100 of these, and then you keep the desiccant in there and keep them away from sunlight. And so that's the way to diagnose urinary tract infections at home. I think I've covered everything. Certainly let me know if there are other topics that you'd like me to discuss in the future. Thanks, and good day.